progress. We now move into session 1, which explores the geopolitical challenges and implications for trade and health policies and equities. This session will examine how geopolitical tension shape trade frameworks, disrupt supply chains, and impact access to health services, especially in developing regions. Please welcome our distinguished speakers, Dr. Bruno Casella, Senior Economist, Investment and Enterprise Division at United Nations Conference on Trade and Development, Dr. Anne-Marie Thow, Professor, Public Policy and Health, Faculty of Medicine and Health, the University of Sydney, Australia, Ms. Prewprae Chumrum, Director, Bureau of Trade in Goods, Department of Trade Negotiations, Ministry of Commerce, Thailand. This session will be moderated by Her Excellency Pimchanok Pitfield, Ambassador, Permanent Representative of Thailand to the World Trade Organization and the World Intellectual Property Organization, Geneva, Switzerland. Please welcome to the stage.
Good morning, everyone, and I'm very sorry I'm in this state because I've just coming straight from the airport, and just landed at 7 o'clock and got stuck on the highway. As we all know in Thailand, you cannot go anywhere within 1 hour. You have to be like 2 hours. So I'm very sorry, but I'm ready for the substance, and I'm very excited to be moderating this session, and I'm glad that I have just arrived in time to listen to the overall pictures from Dr. Mark Saxer, which I will continue perfectly from what he just said. Our session, we are going to look at geopolitical effects, but specifically on trade and health. So Dr. Saxer, he has touched upon the big picture, the broad pictures of what is going on around the world, as well as things that happen in economic terms and everything. For me, I would like just to maybe briefly capture some of the things that I see having the geopolitical factors affecting trade and health in particular. And then I will introduce our distinguished panelists. And welcome, Dr. Casella. I know you are in Geneva, so you must be about 4 or 5 a.m. right? 3 a.m., yes, I know, because I'm very sleepy as well. I think to save the time, I would go quickly on what I think is the implications of geopolitical change on trade and health. Of course, reflecting what Dr. Saxer just said, the first thing is health supply chain security and industrial policy has become a norm. So I think he was mentioning about weaponizing many things, and I think in trade and health, trade and health has become weaponized by President Trump and other factors. We are seeing things like health security, industrial policies, localized friendshoring, and that kind of stuff. So the first thing that I think specifically to trade and health implications from geopolitics is it has become weaponized or national security issue. The second thing that I have observed is that since last year when I was here at the conference, trade measures and export restrictions remain affecting access to trade and health. Not only intellectual property, but some export restrictions remain in place, and they are still barriers to access to health service and healthcare. The third development that we cannot, we have to talk about is that the successful conclusion of the WHO pandemic agreement in May this year. But as we all, I'm sure that all of you who are in the health sector knows better than me that the important part the important part of the agreement, the annexes and everything, are not yet concluded. And so for me, there has been a success of multilateral collaborations, but it's still under big challenges because the important thing cannot be concluded yet. The fourth implications that I can see is that financing and institutional competition, from President Trump changing policy as well as other developed countries, policy to reduce assistance for development purposes or for technical assistance, or in some cases, changing focus to pay more money to defense or to buy weapons. For me personally, I find that's very sad, but it is happening. People, governments are seeing the national security more important than other things. This is a worrying development. And last but not least, I think there have been fast development of technology in trade, in health sector, and this is going to be important more in the future, not only AI, but also other things. So these are the 5 things that I see as the implications of geopolitical changes on trade and health in particular. So now we are going to listen to our distinguished panelists on the topic that I have communicated with you earlier, is that the first round will be about what do you see in your area specifically on the geopolitical changes in the area of work that you are doing. And then the second part, we will talk about what you see as the future. I will introduce our first speaker is Dr. Anne-Marie Thow. I heard you were called Thow. I'm sure. I'm not sure whether that is correct, but I hope it is. Anne-Marie is a professor in public policy and health at the University of Sydney, and she has over 20 years of experience in policy research, including work in Australia, Africa, Europe, Latin America, Asia, and the Pacific. And also she's an expert on trade and health. So I'm sure she will share with us a lot of things that is going on. So I will give the floor to you first, Anne-Marie.
Thank you so much, Ambassador, and thanks for the invitation to Dr. Chaim and to the organising committee. And thank you also, Dr. Mark. It was a really excellent opening. And I wanted to start as well with reflecting on some of these shifts that I've particularly encountered in my own research. And as has been noted this morning, really seeing this polarisation in approaches to trade policy along political lines, and a layering of agreements, that there are new forms of economic agreements being made, but they're being layered on top of old generation agreements, which has interesting implications, which I'll speak to later. I would also note that this shift that we're seeing to regionalism has actually been a long-term shift, effectively since the sort of staggered collapse of the Doha round. So this is something that we've been seeing for 15 years. And that we're also seeing, as I think was said very eloquently, a growing influence of political alignment on trade flows and then on the structure of supply chains. And I thought your point about the way that this engenders both disruption and also resilience was a really important point. I also wanted to add that one thing that I'm also noting is a growing understanding of the impact of historical legacies on trade policy, but also on supply chains. And I think particularly legacies of colonisation and legacies of power imbalances in terms of, as you noted, the origins of the multilateral system being rooted in very heavily colonial contexts. And I think also then recognition of the need to rethink the way that we structure global cooperation. Anyway, so one thing that I wanted to start with is actually some of the positives that I've noted that are emerging from this context. One of those is the way that these new agreements have been able to recognise and integrate sustainable development into agreements which historically have been very narrowly economically focused. And I think this can have a range of really positive implications for health. The first is that we've seen cooperation extended to a range of trade-related issues. So that includes areas that are relevant to preventive health, such as nutrition and food security, which I work on, but also extending that to healthcare. So as an example, the UK-Australia agreement actually had a side letter, a letter of cooperation specifically on health. Which again was very soft policy, but I think recognises the centrality of health to development, as you highlighted. I've also seen and been studying new sustainable food systems chapters under the umbrella of sustainable development, which have been spearheaded by the European Union, but they, for the first time, mean that healthy diets have been mentioned in economic agreements, which has never happened before. We've also seen a pushback against the investor-state dispute settlement mechanism, which I think is really, it shouldn't be underestimated. The recognition that there is a need to regulate poor investor behaviour, particularly where it has implications for health. So this has included both new provisions that have limited the scope of the ISDS mechanism, but it's also included just an outright exclusion and reversion to state-state dispute settlement, which I think has been really interesting. And recently I've just concluded a project mapping health safeguards and seeking to understand what that interface between health and trade, particularly in treaty text related to both trade and investment, has looked like. I think we've also seen, with the shift to regionalism, a shift in the way that sustainable development has been contextualised in this agreement, which I think can actually have quite positive implications for the way health gets foregrounded. And finally, what's been interesting just recently is to see the inclusion of newer forms of trade language in health agreements, like the pandemic agreement. So there are clauses in the pandemic agreement which refer to trade, I think, in more nuanced ways than the historical, please don't talk about trade in this forum because it's a health forum / food forum, whatever. I see this a lot with my work at the global level. I will also note, of course, that there are major concerns, and I don't list the positives to try to suggest that there aren't. So, as I mentioned, one of the downsides is that we do see these newer forms of agreements and this innovation layered on top of old agreements, and renegotiation of old-style agreements at the bilateral and regional level has been very, very hard and politically unpalatable, which of course means that new agreements that don't include ISDS are often layered on top of old agreements that do include ISDS, and so it's still there to be used. And I think we also see very strong colonial legacies in the very old style agreements dating, particularly for bilateral investment treaties from the 50s and 60s. We also, of course, see trade policy being used as a unilateral instrument to push for domestic policy change. And I think this can have significant repercussions for health. For example, leveraging of trade-related measures to open up protected sectors or to lower standards related to health or to food. We, of course, see regional conflict disrupting supply chains in quite significant ways. And of course, a pushback in terms of funding related to global health, diversity, equity, and inclusion, which is reducing global cooperation on important challenges that span boundaries, that span borders. So, for example, climate change and pandemic preparedness. So I just wanted to briefly pick up on some points related to what this means for making health policy. One of those is the priority shift, which you alluded to, that we do see fiscal tightening, meaning a strong focus on domestic health sector resource mobilisation in a context where increasing finance is being devoted to security, the health budgets. And I'm going to pass to my colleagues. I'll leave it there, but thank you very much for the opportunity.
Thank you very much, Anne-Marie, for giving us some of the observations that happen in your areas of work, like development of new languages in newer generation of agreement, as well as shifting of some focus on some key policy areas that you mentioned. For those of you who are not familiar with trade negotiations, Anne-Marie mentioned about ISDS. It stands for Investor-State Dispute Settlement. So it is a dispute settlement that is in use between private sector and the government. It's not government in dispute settlement like in the WTO system, the DS, but the ISDS is very, very important in terms of healthcare. I hope that we will have some time to discuss about this maybe afterward. So in the interest of time, I will move on to our second speaker, Director Prewprae. I know her since she entered the Ministry of Commerce. She's a real expert on WTO rules, and but she has, like me, we have expanded to cover regional and bilateral negotiations. Before she became the Director for Trade in Goods, she was doing services negotiations as well as investment, and therefore she had been quite accustomed to the health sector. So the question that I have for you, Prew, is that you just come back from the ASEAN summit, and maybe did you see President Trump? Okay, whatever. But we're just picking up from what Anne-Marie talked about. So what in your areas of work, what do you think are the prospect of the multilateral, regional, and bilateral negotiations that are related to trade and health issues?
Thank you very much, Ambassador. Distinguished delegates, very good morning. Thank you, Dr. Mark, as well, for providing a full picture of setting the scene, I would say. I'm just come back from ASEAN Summit, but actually previously, just pop by Geneva, go to UNCTAD, actually.
Like hop on a bus.
So actually, from UNCTAD to ASEAN, I think it's the same sentiment regarding how resilience we need. And people, keep saying about supply chain resilience. I think that's really a keyword for this month. President Trump and all the policies maker are looking at. When we talk about healthcare, I would say, I would imagine, Dr. Mark mentions about traditional flow, right? Goods, services, investment, capital. Now we're talking about data. It's all about the digital world that we are seeing now. Actually, when we say digital, a lot of perceptions, bad things, good things about the digital economy. But actually, from what I heard from UNCTAD as well as from ASEAN, digital technology would help creating more resilience, combating climate change, and also, take care of the public health sector as well. Just try to pick up from Dr. Anne-Marie mentions about the text we are talking. I think the public health, the health issue is very sensitive. Doing trade treaties, agreements, you normally have like general exceptions, security exceptions. You have prudential carve-out for financial services. I think regarding the health sector, Dr. Anne-Marie is very put it correctly. We see the developments of the new text coming, like carve out for certain sector or even products from ISCS coverage. We're seeing the more and more policy space people may need in the doing text negotiations. We see a lot of agreements, a lot of treaties having the legitimate public policy objective. This terminology is well known and really globally recognized. But I would say that LPPO is not, everything. You need a certain legitimate ground to use that, right? Talking about the digital a bit, when we talk about the flow of data, of course, the flow of data also cover the health sector. Looking at the hospital, when we talk about the patients, right? We're talking about history of the medications you take. Actually, everything is, before is manually, in writing, is now digitally. I'm going to say that when we're doing the digital agreement as of today, actually, we have to strike the balance between the right to regulate of the states and also the room for innovation for the private sector. Actually, the digital technology evolved very quickly and would help, maintaining or even upgrading the healthcare sector as well. But when we talk about the cross-border data flow, people would, quite afraid or have a concerns, right? Oh, whether with the leak of the data. But actually, you have another layers of the law enforcement regarding personal data protections. So actually, PDPA, together with the free flow of data, and together with the exceptions available for the state to take measure, if you don't see it right, you can still have the right to take certain measures to protect certain, integrity or the personal data. We talk about resilience. I think what ASEAN and actually the sentiment from UNCTAD, actually UNCTAD is a good venue that we learn from other as well, because we see, I would give the credit to the WTO public forum as well, that we see a developments in other regions. I wouldn't say that Asia Pacific, we can just, looking at our neighbor and then finish, but you have to look into what the development is happening, around the global arena. Actually, we see a lot of, proactive agreements from African region. We see from the Latin America. And actually, I can say that we are moving into the same direction. Try to keep it more transparent, more open, rule-based, multilateral, still the important one. I think the more uncertainty we have, the more rules, the more collaborations in the legal binding way is also a keyword that we need to try to abide by. I think for ASEAN development, of course, regarding the health sector, apart from liberalization, that I have to say that from the trade perspective, we see a lot of shift these days, like from the demographic change, certainties and everything. Even liberalizations before last decade, you never see the health sector opening up for liberalization. But now you see more and more, but of course maybe more and more, but not everything, right? Elderly care, certain care that they probably need to open more because there's not sufficient supplier in the market. Also, we see the requirement or the strong need from the human service provider as well. Caretaker professionals like doctor and nurse are really in need as well. So actually this is from the trade perspective that we see some change happening. I think I may stop now.
Okay, thank you very much. Prew talked about the supply chain resilience a little bit, but for her, it is a digital transformation that is taking place around the world that will have implications on healthcare sector. And I would say, yeah, it's for the better, isn't it? Not for the worse, hopefully, but we'll see. So let's go to Geneva, to Angtat. Professor, doctor, just a moment. I forgot to put you. Dr. Bruno Casella, who is a senior economist of investment and enterprise division at the United Nations Conference on Trade and Development, or UNCTAD. We just had very excitement last Friday. I heard that, last Thursday, where the meeting was held up until midnight because one major developing countries refused to budge, and wow, that shows how complicated, I don't want to say how messy, but how complicated multilateral collaboration are these days. But Dr. Bruno Casella, who, he has in over a decade been an economist at UNCTAD, but he has been leading economic and policy research in various core areas of multilateral investment agenda, investment and sustainable development goals, like Anne-Marie, and also he has published extensively on these issues. Before joining UNCTAD, he was a manager at McKinsey and Company. But Dr. Bruno, Dr. Casella, may I ask you, shifting a little bit to see 2 points that have not been touched upon by our speakers yet. One is, what do you think is going on at multilateral forum? Maybe in Geneva or at around the world in terms of that, collaboration at multilateral. And the second point that if you can share is the impact on funding and that shifting policy that Dr. Saxer and I also mentioned, and Anne-Marie as well, that there's a shifting of focus in terms of research and funding for this. Has this been affecting UNCTAD efforts on technical assistance or some other matters? So the floor is yours.
Okay, thank you very much. Thank you, Ambassador. Thank you to my fellow panelists. Thank you to the keynote speaker. I'm sorry not to be able to be there. Here is a late night, early morning. It's 4 o'clock in the morning. So I'm coming from my background, as you were mentioning. Is in investment and in particular in FDI. So basically, it's the other side of the coin of global value chains. On the one side, we have trade. On the other side is we have investment. So if I have to think about the impact of geopolitical headwinds on healthcare, and in particularly on funding healthcare. You were mentioning the funding issue. The first thing that comes to my mind is the impact of geopolitics on investment in pharmaceuticals, on the pharmaceutical global value chains that is strictly connected to access to medicine. So that implies an issue of health equity. So if we think about that, geopolitics is having several effects in general on international investment and funding of productive capacity, especially in developing countries, beyond pharmaceuticals. Now, if we think about tariffs, we talk a lot about trade. But the impact on international investment of tariffs is at least as much relevant as for trade. Tariffs introduce uncertainty, and uncertainty has the effect of freezing investment decisions. So the overall activity of international production is slowing down as an effect of tariffs. Tariffs increases the cost of managing global value chains. So moving intermediate goods within global value chain is becoming more expensive. So it's becoming more expensive to invest, to make FDI. Third, tariff push investors to diversify investment. So they change the geography of international production. Fourth, and I'm just giving examples. Fourth, they may even induce some strategic offshoring. So the idea of investing abroad in order to get access to certain markets that would be otherwise affected by tariffs. So what I'm saying by this is that geopolitics has a big and important impact on investment decisions in general. And geopolitics, when it comes to investment, is not just tariff. We are seeing from Geneva a lot of other dimensions where geopolitics is actually reshaping investment beyond tariff. Tariff is just the hottest issue on the table, but we have investment screening, for example, investment screening mechanisms. They are proliferating, especially among developed economies. The number of economies and countries that are applying investment screening mechanisms has doubled in the last 4 or 5 years, and they are almost all developed economies. We are seeing industrial policies. It was mentioned by our keynote speaker. Industrial policies are basically favoring, in some sense, domestic players relative to foreign investors, and they are creating incentives for multinational enterprises to reshore their production. We are also seeing sanctions. So the geopolitical toolkit is much broader than just tariffs, and all these tools, they are reshaping the investment landscape. So that's the second message. The third message is that geopolitical factors have started to affect investment well before the Trump administration. You were asking me, what's the implication of the recent geopolitical developments on what we are doing. But we have been seeing the effect of geopolitics, of these tools that I've just mentioned, for at least a decade. We have done an analysis, and we have shown that the share of investment between countries that would be considered not geopolitically aligned 10 years ago was 25%, more or less. So one investment every 4 investment was done between countries that were not friends but were still continuing to do business together. 10 years along the line, so last year, the share of investment between countries that were not geopolitically friendly was around 10%. So it has become from 1/4 to almost marginal, to a minority. And that has been going on pretty much regularly. It has been declining for the last 10 years. So this has started well before the Trump administration, who has actually accelerated this process. So what has all this to do with health? Well, the first entry point, as I was saying, is pharmaceutical production. The most natural entry point. Why? Because pharmaceutical production, pharmaceutical global value chains are value chains that are very concentrated. So they are very concentrated, and they are value chain where there is a big, and given that there is a lot of concentration, there is a big risk. Concentration is concentrated from 2 perspectives. There are some areas, like Africa, that we are dealing a lot with at UNCTAD, that are very highly dependent from outside in terms of pharmaceutical supply. We know that in Africa, between 70 and 90% of all medicine that are consumed in Africa, they are produced outside. So there is a big dependence from abroad, and that's an issue in this geopolitical context that I've just described. But even the countries that have their own, and the regions that have their own indigenous production of pharmaceuticals, in terms of local formulation, for example, they are highly dependent in terms of the ingredients, of the active ingredients. The vast majority of active ingredients of all medicine produced all around the world is coming from just 2 countries, China and India. So there is a big concentration upstream in that global value chain. That means that those global value chains are highly exposed to these geopolitical shocks that we have just been describing. So what is the solution here? The solution is not, of course, just stockpiling drugs, medicines in order to face shocks, but the solution would be to produce them locally. So this is the local production agenda that we are pushing, especially in countries and regions that are highly dependent from abroad. So, for example, in Africa. The local production agenda is a very important one. UNCTAD is very much engaged in that alongside with WHO, because we think it's a safe response to the shocks, to the past and potential future shocks of pharmaceutical global supply chains, and the best insurance to guarantee access to essential medicines for local people. Unfortunately, and I'm concluding, the local production agenda is a very difficult one. If producing locally had been easy, it would have already happened. So it's important to design policies that are supportive of this agenda and this policy. And we are as UNCTAD, we are we have been advising countries on these, countries and regions on this, and publishing reports. And we are proposing policies that integrate several elements, including incentives for local producers and for multinational enterprises to produce locally, including regional cooperation, including investment in infrastructure, including institutional alignment. These are the main ingredients to make the local production agenda actionable and to implement it.
Thank you so much, Dr. Bruno. So Dr. Bruno has talked about the changing in the supply investment in these healthcare sector areas, and also the impact, not only that not only tariff measures, but other measures that are having impact on access to medicine and essential products. So he already talked about his solution, which is go local, produce more local, and I think also Dr. Anne-Marie and Prewprae also pointing a little bit in the direction that we have to step up our regional cooperation. So for the second round, we have about half an hour left. I would go ask you about what you see as opportunities in this messy world that we are in. But I noticed that Dr. Anne-Marie, you had a little bit some issues pending from your first round of suggestion. So unless you want to touch upon or elaborate on some of the issues that you have raised, but otherwise I would like to ask you to add on what are your perspectives regarding opportunities, and what should we do in the future?
Thank you so much, Madam Ambassador, and it's such a privilege to be part of this panel. And interesting as well to see some themes emerging. One of the things that I had flagged just for myself in this, what to do, was this idea of investing in resilience and what that means. One of the challenges that I think we're coming to terms with is kind of an issue of vision. What does resilience look like in this new, world order? We have become very used to an international trading system which is relatively transparent, very relatively agreed, and that's not the case anymore. And I think this is one of the big challenges, but perhaps also an opportunity. One of the things that I am sort of wrestling with in my own work is who is development for? Right, when we talk about economic growth or economic development, we have seen really significant gains over the last 30 years in many countries, but we've also seen widening inequality of income and of opportunity at the same time, and less, I think, across country lines and more across countries, which is really, this sort of hollowing out in many developed countries of the middle class, but then also this, challenge for the most impoverished people to really move the dial. And I think without undermining the gains, perhaps I see, in terms of investing in resilience moving forward, an opportunity to understand better what it has looked like when we've seen trade deliver economically, but also to come to terms with those situations where we have seen, for example, opening of borders or liberalisation of investment, and then we've seen widening inequality result, or we've seen the benefits accrue really in a disproportionate way to certain groups, and other groups really lose out. And there's of course a long-term discourse in the trade and investment space around mitigating policies, and sometimes I think those have been used very well to ensure that benefits accrue more equitably, and also that, as you said earlier, sorry, I'm going to say your name wrong, Prewprae. I think you made a really good point about protecting policy space and ensuring that social and health policy space is protected in economic policy making. And I think there is a lot of positive examples that we can really learn from, but also to be able to recognise and perhaps use this disruption to deconstruct and to reframe and cast a new vision around who economic development is for and what it looks like for that to be done in a way that does include strategic mitigating policies. One of the initiatives in the last 10 years that I think has been really positive is the Human Capital Project by the World Bank. I think the way that they have reframed and put humans at the centre of development has been a really helpful complement to the Sustainable Development Goals and cast a bit of that vision for what it looks like to do this economic project well into the future. The other thing that I do also want to pick up on is industrial policy, but again through this idea of a mission or purpose-oriented industrial policy. Who are we doing industrial policy for? And I definitely take the point made earlier today about there being a risk with industrial policy related to overcapacitating in certain areas. But what I've I guess been starting to work on myself in more the food and nutrition space is thinking about what it looks like to think about mission and perhaps very locally, like regional as in sub-regions within countries, oriented industrial policy that thinks about equitable growth and improving capacity and opportunity. I think, for example, we see an opportunity for industrial policy to encompass strategic investments domestically for resilience in health systems and in other health-related sectors, including food, transport, urban design and e-commerce. Many of these are excluded from industrial policy remits. It's interesting for me in my home state of New South Wales in Australia, we have a new purpose-oriented industrial policy strategy. It's quite beautiful. It deliberately carves out, for example, the agri-food sector as not relevant, which I find fascinating given its importance environmentally, socially, economically, and for health. So I think there's an opportunity for cross-sectoral engagement because industrial policy is also, of course, trade adjacent. Right? It's inextricably intertwined with the way that we think about and we do trade policy, particularly when we talk about mitigating policy, supporting those who lose from opening of sectors. The second thing I wanted to pick up on was the conversations about regionalism to date. It was really interesting to hear about your experiences in ASEAN recently. I do see regional bodies emerging as leaders in conceptualising integrated policy agendas. So less as we see in the multilateral system of here we're talking about trade, here we're talking about food, here we're talking about health, and more capacity at the regional level to think about the way that these different sectors interrelate. And there are trade-offs that need to be managed and made explicit. I think unfortunately, I'm a huge believer in multilateralism, but I think many of those trade-offs can be kind of swept under the table or just forum shifted in a multilateral sector-based system, and those conversations can happen in a different way at the regional level. So I think that there is an opportunity for leadership from regions around what a new agenda looks like. I think we see this very much in the EU, and they have conceptualised a regional agenda, but I've been working with colleagues across Asia and Africa, particularly looking at, and the Pacific as well, in terms of what it looks like for regional bodies to set agendas for and cast a vision for trade and investment policy that also accompanies more equitable, resilient social and economic development. I would also say that there's an interesting interface between regional leadership and the multilateral system. We have, of course, seen regional blocs emerge as quite powerful in the WTO system. And in the the way that those regional blocs, for example, the BRICS, but also the G77, shaping agendas and interpreting that interface between health agreements and trade agreements. I know there's a lot of interest in that interpretation with respect to the pandemic agreement, but I think we saw, similarly in the early 2000s, the reinterpretation of the TRIPS agreement to, at least theoretically, support more equitable access to medicines. And that shows to me that this kind of change is possible, that we actually can see leadership from the majority world in reinterpreting and starting to rethink some of these multilateral agreements. Finally, I see an opportunity for strategic research. What I'm fascinated about in the current context is the way that we see these really interesting innovations at the interface between trade and health that are very positive, sitting alongside really problematic and challenging geopolitical evolutions, which I'm really excited about discussing further during these next couple of days, because what I see an opportunity for research to do is to learn from the experience that we have had over the past even 30 or 40 years around how the interface between trade and health has been understood and managed, and how we've seen innovation both in the health space and in the trade space to improve outcomes. And that, I think, is a huge opportunity, particularly because much of the innovation has been in the developing world. I think and yet we saw this during COVID, the way that global learning is understood and perpetuated tends to just happen upon quite narrow lines. And this is something I'd love to see disruption enhance. Actually, this idea in the health literature of reverse innovation, that actually in many low and middle income countries, we've seen like a skip in the digital evolution of healthcare, for example, straight to digital systems, particularly in the African region where there was quite poor manual health system documentation, and they've just skipped straight to digital. I think there's so much to be learned from these examples of innovation. I also see an opportunity to ask some better questions about who benefits and how mitigating policies can be used more strategically in the trade space, and to disentangle and to recognise the benefits of trade, but also the problems and the negative impacts, and to really push into this, these issues around equity in terms of who's benefiting and what it looks like to safeguard policy space, what it looks like to introduce mitigating policies to improve outcomes for society as a whole. Thank you very much.
Thank you so much. Full of interesting ideas, investment resilience, industrial policy, regionalism, and etc. I think we will go straight to Prew because we only have about 13 minutes left. And then maybe Dr. Bruno also would like to have some comments. So, yeah.
Thank you, Ambassador. Actually, when we talk about supply chain resilience, I would say that it's all about the whole value chain. I think Dr. Bruno mentions about manufacturing. Actually, when we have the new policies, coming, different requirements, so actually what are you sourcing today may be not valid. You cannot enter a particular market anymore. And actually, I don't think that all industry have that agile to shift, sourcing quickly, and you can secure local content that you can access. And actually the deal, if you observe the news that, to see a lot of trade package coming from different countries, it's not just, our and then the US, right? But actually the US with others also affecting all the whole supply chains together. Talking about that manufacturing one hand, rules of origin, cost of compliance, different conditions apply, different sourcings, looking at the service and investment, right? Now is the policy is shifting. I think we heard about screening regimes regarding security, maybe not really on public health, but maybe on digital. also the more requirement on storage, processing, equipment, right? Today you heard about the fee increase for the vessel. If not, nationality that really eligible, you will find more cost of transportation. So actually the whole picture of the supply chain is being disrupted. I definitely agree with Dr. Amari when looking at opportunities. Regional have to work closer, best practice, sharing best practice, keep your laws and regulations more transparent, publicly available. I think that the key message, at least to give predictability to the business community when you're looking at what would be the certain rules and certain law. Because sometimes it doesn't, we cannot change anything overnight, but I think from the business perspective, it's really, really important to see that what is the directions of the policymaker. Looking at the regional-wise Asia Pacific and also looking at the collaborations with UNCTAD, I think diversifications is a key. Rules-based issue is also a must, right? And then we're looking at what would be the mitigation for the possible risks, because the risks that we see today may be more or maybe less for tomorrow. So actually, I think it's time for the government or the policymaker to step back a bit. And then I would agree with Anne-Marie when you're talking about what would be the proper policy for the future. So actually, when you're talking about the competitive ecosystem, right, it's all about the market-driven. We talk about the competitions, but now maybe not really a case, right? Competitiveness of the country is being disrupted as well. I would say that a lot of industry, you cannot doing like the wholly obtained industry in your country. We heard about the different sourcing, the one services and one product is a combination of a lot of contents, a lot of raw materials around the world. But with the new change of the policy from certain country, I think we do need to rearrange it again and again. So it's all about how can we really secure the resiliency. I think for ASEAN, we are talking about, and I think also UNCTAD as well, talking about the quality investment that we would have. We're looking more corporate responsibility. We're looking at more greener, more combating on climate change issues. And I think that is the way that we will survive at the end. So actually, one hand, you try to survive economically, but the other hand, don't forget that you have other factors that will be plugged in. And I think the more conversations we have, collaborations we have in the regions and the world at UNCTAD and WTO, that would also help us to mitigate the risk even more. Thank you.
Thank you very much. Dr. Bruno, yeah, your final thoughts from Geneva?
Yes, thank you, Ambassador. I just wanted to highlight one opportunity and perhaps make a little consideration about regionalism that has been discussed quite a lot also by the other panelists. So and this consideration I make about the opportunity is links to one, I think, one key point that our keynote speaker was making about the fact that the traditional development model, the flying geese model, he said it's obsolete. Perhaps I would be a little bit more diplomatic, saying that is in crisis, and I fully agree with him on that. In the sense that for the reason he was mentioning, the various the underlying rationale of that model by which countries, developing countries start from the bottom of the development ladder, by attracting investment in commodity and basic manufacturing, and then climbing the ladder. the very rational of those models that is basically that has to do with labor costs and trade and GVCs. They are under threat. So I fully agree with that, and I fully agree that is the big challenge for us, like in UNCTAD, working on development. And he mentioned the fact that we don't have other models at hand to replace that model. So right now I'm working on a report that is titled an investment development agenda for a fracturing world, where we are exactly saying that model will not deliver anymore as much as was delivering before in terms of development dividends. So what are our models we can propose? Now, one of the things we propose there is to anchor more and more, and this relates also to the intervention of Ms. Thow, to relate much more investment to SDGs, to Sustainable Development Goals, anchor them to these to Sustainable Development Goals. Why that? Because these are the kind of investment that are more protected from geopolitical, industrial, business headwinds. They are more supported by politics. They are not just driven by markets, but by needs. And when we talk about that, we talk about green investment, a certain type of digital investment that is conducive to digital transformation, but we also think about healthcare investment. So from that perspective, we think that healthcare investment is not just something that can support health equity, but it's also a valid alternative to the traditional GVC intensive industry as a mean for poor countries to develop. No? So in that sense, I think it's a big opportunity that stands really at the crossroad, at the key crossroad of today's debate about development. It was touched by our keynote speaker as well. And let me just add a very short point on regionalism. I fully agree about regionalism. I fully agree that it's a big, that has a big potential, and that is, at least in theory, conceptually, a very valid alternative and complement to multilateralism that is going through a kind of crisis. Unfortunately, for example, in investment, is not happening yet, or is not happening at the same pace that we should expect based on these premises. So we should question ourselves why this is not happening. And it's probably more complex than we think. I think that one of the elements of complexity is the fact that in the project I did, a regional project I did one on production of antibiotics in East Africa. One of the issues is that you need to design regional value chain before designing regionalism. I don't know if I understand what I mean, but I mean, one of the issues is that in the regional discussion, it's very complex to design how the different countries in the region can effectively contribute to regional cooperation, and how smaller countries, for example, can be protected by being jeopardized by bigger countries. This was the biggest issue when it was coming, when we were talking about regional production, and we had in the same region Kenya and Burundi. Okay, so this is so you need to design a regional value chain where all the different countries, they can effectively contribute and extract value from this. And this is not at all easy. And this is, I think, one of the main reasons why, despite the fact that we have been saying for 10 years, 15 years, regionalism is a great idea. If you look at intra-regional investment, is still much smaller than it should be.
Okay, so I thought we had a consensus on regionalism should be the way to go, but it seems Dr. Bruno is not entirely agree with that. Maybe, but of course we are open on all ideas. I think I have 1 minute left to summarize, and the questions, my task that I have been given from the organizer, that I must extract recommendation as well as research questions. So I think from our speakers, and I'm very glad that I think Dr. Anne-Marie will be speaking on another session. So we'll have more time to ask questions from her and listen to more inputs from her later. I think for this morning, we have seen that there are a lot of impacts on trade and health and nexus, but it is not all for the worst, because while the world is changing, I think health sector is also changing. I think this is very clear. We have seen that even in terms of legal texts or something, texts are evolving with time, and not only in I think that the main happening was the pandemic treaty, but also there are regional agreement and bilateral agreement. We can also see unilateral measures, from President Trump, focusing a lot on pharmaceutical and medical devices a lot. So there are some challenges, but also there are opportunities because the sector itself is evolving. The second thing that I could see and heard today is that trade and health is no longer viewed among our panelists as independent, but is form a part of emerging debate or agenda on sustainable development, on well-being, on other development. And Dr. Anne-Marie talked passionately about unequal access to healthcare and stuff like that. And also Dr. Bruno talks about we have to make sure that smaller countries can have better understanding on regional cooperation and benefits that regionalism can bring before we start going that route. But the third point is that, to my surprise, because maybe I have not looked at this aspect more when I'm cover trade and health in Geneva, is investment. It seems that all three panelists, they agree that investment is a very important enabler of, for trade and health issue to develop further. We have heard about how to maintain, investment resilience, but we also need to understand what they are for, who they are for, who the investment should benefit. So these are your research questions. I think one important thing is investment in healthcare sector. Where should it go? Who should it benefit? And how to make it really useful for everybody. And of course, we heard about regionalism, that because of the paralysis in multilateral level, maybe now there are more leadership roles that regional cooperation can step up the work. I think even Dr. Bruno, I'm sure he didn't disagree that regional cooperation and action have a role to play. But maybe we should be mindful that different regions have different priorities and different level of development. And let's say like in Asia we have quite a good development of digital economy, but maybe in Africa they are catching up, but not so fast as they are hoping for. But anyway, I think for me these are about four aspects that I have seen emerging from this. It points to the fact that we have to design trade and health policy in a way that is modern, up to date and up to development in the world, so that to use the political theme, so we will leave no one behind, because at the end of the day, health care is a very, very important issue, and I hope that all these geopolitical challenges would not stop us from keeping our good work in maintaining access to and equitable access to healthcare sector. So that is me from a little bit sleepy, but these are all the issues that I pick up from. But I forgot to mention industrial policy, but I have some information. Maybe I can talk to Dr. Anne-Marie later, that unfortunately the industrial policy that is being negotiated at the WTO is nothing about what you want to see. It's mainly about electric vehicles. That is what they think of industrial policy. Healthcare is not yet a part of the debate there. So maybe I should introduce SDG into the industrial policy that you are hoping to see there. So this is all. I hope that give Dr. Shaim some points. I will summarize it, and because tomorrow I have to do the summary as well. I will get all the points down. Thank you very much. Thank you, Dr. Bruno from Geneva as well. Thank you, Dr. Anne-Marie and Director Prewprae.
Thank you.